The main aim of this project is to ensure that Gypsy and traveller women access maternity services early on in their pregnancy, but equally that maternity unit staff are responsive to the individual needs and requirements of this community. My name is May Buckley. I'm the Director of Midwifery and Gynaecological Nursing at the Royal Free NHS Trust, which is a London hospital. Our client and staff population are extremely diverse, and for that particular reason we want to ensure equality to all. The Pacesetters programme is a partnership between local communities who experience health inequalities, the Department of Health and the National Health Service. The Pacesetters' objective is to engage the seldom heard groups and is based on three fundamental principles. The first principle is to engage the local community. The second is to ensure that there is good continuous dialogue and a good working relationship. The third principle is that health professionals will need to have an understanding of how communities function at a local level. The Gypsy and Traveller project is just one of the Pacesetter projects that the Royal Free NHS Trust has been involved in. The health status of gypsies and travellers is much poorer than that of the general population, even when you control for factors such as socio-economic status or ethnicity. A number of reports on maternal health refer to gypsy and traveller women. These communities may not gain access to maternity services for a variety of reasons, particularly those who are highly mobile, which may lead to poor follow-up of antenatal care and may result in poor outcomes for both mother and baby.
I love being a travel girl because you mainly can go to weddings and you meet your own people and then you can have a good time.
We're proud who we are, we love being who we are. Wouldn't change it for anything.
The Irish Travellers movement in Britain was developed a number of years ago. I think we're actually 10 years old. We estimate that there's possibly I would say maybe 400,000 Gypsy, Traveller and Roma within the country. There are lots of difficulties in accessing services. Once the community do access the services, again there are lots of difficulties around cultural barriers, the professionals understanding where the community are coming from, for the community the fact that literacy may be poor. Accessing just that kind of written information, mobility, these are all issues that kind of impact heavily on that access to services. The health status of gypsies and travellers across the UK, indeed across Europe, is very, very poor in comparison to other BME communities and much, much worse in comparison to the general population. Infant mortality rates are much higher than any other community.
An overwhelming majority have lost a child. We were doing a cultural awareness training, and of the 14 women who were receiving the training from the maternity department, none of them had lost a child, and of the 3 people delivering the Irish Travellers, each one had lost a child. And I think that just summed up the statistic massively, it was just so disproportionate.
My mum lost 4 children, buried. I'm one of 10 and there's only 6 left, and they all died, like babies. Travellers are the only ethnic minority that's not recognised, because if you called a black person a certain name or a wrong name, that's racist, but you can call a traveller pikey and nothing can happen to you.
In schools as well, most of the travelling children are all bullied in school, and then they don't get an education because they can't stay in the schools because they're always bullied and things. Yeah, so it's hard for them then to learn to read and write and all that.
They might have a receptionist humiliating them in front of a big group of people, other patients that's waiting. So they walk out and they won't go back.
I do, as a traveller, feel intimidated a lot by the system, we feel intimidated by a lot of people. So that's why I think a lot of the help that is provided, we don't take up.
We have a culture of our own. We have our own language. It's what we believe, it's what we are, you know, it's our inheritance. We are an ethnic group. And I would like to think that we have the rights, our human rights, our basic rights.
People are unfamiliar with the community and don't know how the community interact. I mean, lots of travellers will speak in a very direct way and maybe slightly louder. We don't seem to kind of recognise ethnic minority as white, and there's a huge misunderstanding there.
People's expectations is that gypsies and travellers want to shout the odds and want more than everybody else, when really they just want the same. It's about equality.